Imagine that you accidentally broke one of your neighbor's windows. What would you do? You could stay silent, no one will ever find out that you're guilty, but the window doesn't get fixed. You can try to repair the cracked window with some tape, not the best long term solution. Or you could put in a new window. Not only do you solve the problem, but also you do the honorable thing.
What does this have to do with gene therapy?
Good question, Christina. You can think of a medical condition or illness as a broken window. Many medical conditions result from flaws or mutations in one or more of a person's genes. Mutations cause the protein encoded by that gene to malfunction. When a protein malfunctions, cells that rely on that protein's function can behave normally, causing problems for whole tissues or organs. Medical conditions related to gene mutations are called genetic disorders.
If it is successful, gene therapy provides a way to fix a problem at its source. Adding a corrected copy of the gene may help the affected cells, tissues, and organs to work properly. Gene therapy differs from traditional drug-based approaches, which may treat the problem, but which do not repair the underlying genetic flaw.
But gene therapy is not a simple solution. It's not a molecular bandage that will automatically fix a disorder. Although scientists and physicians have made progress in gene therapy research, they have much more work to do before they can realize its full potential. Come in.
Good morning,
doctor.
Good morning.
Good morning.
Please take a seat. What seems to be the problem?
Well, I feel like I have a lot of mucus in my lungs. I can't breathe, and I cough a lot.
After careful analysis, you have cystic fibrosis.
Cystic fibrosis? What is that?
Cystic fibrosis, CF, is an hereditary disorder that affects the cells of the lungs, pancreas, and small intestines.
Abnormal mucus secretion in these regions cause symptoms such as coughing, poor digestion, and increased vulnerability to infection. Most untreated CF individuals will develop fatal lung infections and will not live past their late 20s.
Cells that line the airways in the lungs produce abnormal mucus due to a mutation in the CFTR, cystic fibrosis transmembrane regulator, gene on chromosome 7.
Most commonly, the mutation in the CFTR gene is a 3-base pair deletion.
Deletion of these base pairs in the gene sequence results in the deletion of one amino acid in the protein that's produced.
In normal cells, the CFTR protein functions as a channel to move chloride ions across cell membranes.
The CFTR chloride channel works with other channels to set up an ionic gradient, a difference in the number and type of ions that are inside versus outside the cell.
Normally, cells have more chloride ions outside the cell than inside.
More chloride ions are outside the cell because they attract water out of the cell and into mucus layer.
The mucus layer protects cells by trapping inhaled particles and bacteria. Keeping the mucus layer moist allows the cilia to seep out this harmful debris.
When the CFTR channel protein is mutated in cystic fibrosis, it cannot transport chloride ions across the membrane.
As a result, too few chloride ions move into the mucus layer and too many sodium ions move into the cell.
The movement of sodium ions into the cell causes the water to reverse direction and flow back into the cell, drying out the mucus layer.
The mucus layer becomes thick and sticky, preventing the cilia from clearing debris. This causes infections in individuals with SF.
Since all of the cells of the CF patient have the defective protein, large quantities of thick, sticky mucus build up throughout the lungs and other organs. This results in the severity of symptoms seen in CF patients.
Would cystic fibrosis make a good candidate for gene therapy?
Will adding a normal copy of the gene fix the problem in the affected tissue?
The answer is actually yes. While the mutated CFTR gene encodes for non-functional ion channel proteins, it will not prevent a normal CFTR channel protein from working properly. Therefore, adding a normal copy of the CFTR gene should fix the problem.
Is it feasible to deliver the gene to cells of the affected tissue?
Yes, in part, treating the lungs of patients with CF might be feasible, since the lung surfaces are exposed to the air and somewhat easy to reach. Because the digestive system is less accessible, however, it might be a more difficult region to treat.
Thank you.
No problem.
Now you know more. We have decided that cystic fibrosis is a good target for gene therapy.
Now, let's design a way to deliver a normal copy of the CFTR gene into a patient's airway cells. Which vectors can we exclude based on gene length?
Well, what vectors do we have?
We have the herpes simplex virus, the retrovirus, the adenovirus, adeno-associated virus, or the liposome naked DNA.
Well, actually, the gene is small enough to fit into any of these vectors. Therefore, you cannot exclude any vectors based on gene length. Adeno-associated viruses typically will not cause an immune response.
It looks like the adeno-associated virus is your best choice for CFTR gene delivery.
Welcome to the Gene Transfer Laboratory. Here, we'll build our vector and test it in cells grown in the laboratory. Researchers must test each gene delivery approach this way to ensure that it works before trying it in patients.
Hello, Dr. Arlandis here in the Institute American School of Barcelona. We're going to perform a cystic fibrosis operation. I have my helper here, Mark Smith, and we're just going to go into it. The patient, as you can see, is already cut open. We're going to analyze the lung. We're going to suction out all the mucus. Is the operation going correct? Okay. And now we have the correct gene. We're just gonna implant it. We're suctioning out all the mucus as we go along because it's very effective. We're trying not to damage the other organs. And now that it's all clear, we're gonna change the gene to the correct one. We've already created all these bacteria cells that have the correct CFTR gene. It was a success. Now we're just gonna put her skin back on.
It's been 5 days since my operation, and I'm fantastic.
I can now properly breathe. If you have cystic fibrosis, don't hesitate and go to Dr. Smith and Dr. Hernandez.